Of this noble profession, a profession that has been sleepless night. I think we have spent a lot of sleepless nights. We have attended a lot of emergency calls, difficult decisions, human suffering, and I can say tears of families, relief after recovery, silence after loss, a lot of things, like lifelong responsibility which you have taken. Fine. And we have become a breeze between, we can say, disease and hope. We all agree, and I'm really proud of this big community of doctors, and we all are senior people sitting out here. And today's episode is very special because we are all a part of the healthcare system. And how can we think of something more than this? Because we all have been doing it 30 years, 35 years, 40 years, 50 years. Everybody has been doing this profession and you know each and everything of this profession. I don't have to say much, but there are many times we have a lot of thoughts that comes into our mind. We also want that some correction is needed, somewhere some revolution is needed, somewhere something we want to do. But most of the times we keep our thoughts within us and we never progress. And that thing has come to me since long. And I thought, can we do something? Can we do something? And this has led to this place where we are sitting today and we're discussing. And we have a very cordial environment, which I think Akashbani Bhubaneswar has created so that we can pass on our thoughts and things. So today, we are going to talk about redefining health industry from disease care, because I always say the industry which we are working, it was never a healthcare industry. I think it is a misnomer because we treat disease here. So, because we are known as healthcare professionals, so can we do something to redefine it from disease care to healthcare? So, because from decades we doctors are fighting with the disease. We are there to prevent death, and we have performed surgeries, we have managed emergencies, we have used medicine, machines, protocols, investigation, technology, and our clinical judgment. I think this is the most important part of it. Today we will be discussing about the redefining of healthcare industry from disease care to healthcare. So the future actually that belongs to the doctors who integrate treatment, because now we are not integrating, we are just using our knowledge, and the modern medicine is now so much of fragmented. I think 30 years back, a doctor used to treat everything, but now it has been fragmented, so we do not have connection between each other. So who integrate treatment, prevention, self-health care, technology, and human wisdom. This is the future. We have to think of this. If we are not able to do practice today, our next generation doctors has to practice this one to come out, to evolve in a better way. We have reached to a stage where you can discuss these matters. So I always say for decades, medicine has been fought diseases and prevent death. Now doctors must lead the shift towards quality of life. Because we are not leading, we are leading towards disease care. But we are not doing anything to shift towards quality of life. And our work is limited in the prevention, and on self-health care, it is really not much, because we don't take care of ourselves also. So somewhere we have to work in this field, and ultimately we have to go for the human care. So what is that? What is the difference between disease care, health care, and human care? Let us just have an idea. Because disease care, what we are doing every day. We are going for diagnosis, we are doing investigations, we are treating, we are giving medications, we are doing surgeries. All these are coming under disease care. But when it comes to healthcare, we have to look into the pattern of life. What type of pattern the patient is having. Like here we are looking at what type of disease the patient has got. But when we go for the healthcare, we will be asking a different question. Which person has got the disease? Because there are two different things. Because when you look into the disease, we forget the person. But when we look at the person, and we will know why the person has got the disease, and we can treat the patient, I think it will be easier for us to treat. And I do certain aspect of healthcare because I first discuss about the patient's life, what he is doing, from where he has come. And I know that why the person has fallen into the trap of this particular problem. Because 70 to 80% of diseases are psychosomatic. In my OPD, if I see a person coming with big paper, this much of a file, I know that person is not having much problem. So we have to somewhere connect and ask about about why he has acquired this type of problem. And ultimately come the human care. Human care means we have to see what dignity the person is losing, or is fear of losing, what type of hope he has got, and what is the meaning, and why he needs the attention. Why he's seeking the attention? Because they are the people, but the majority of people, they need human care. So when we are focused on disease care only, then we are somewhere we are not able to give, because the load is very high. So we are not able to give much of the importance to this health care and the human care. So today we'll discuss, can we do something to improve the healthcare, redefine the healthcare system? So disease care is necessary, but disease care alone is not enough. There, our rethinking in the where we have to do something more. This was the movie dialogue. The doctor's mission should not be only to prevent death, but to improve the quality of life. That is very important. If we treat only disease, we may win or lose. Not actually we do every day, either we are winning or losing somebody. But we treat a person, we win, whatever the outcome. That is the area where you have to focus. Because when we treat a person, we win, we will always be winning. Fine? Because there we are talking about his fear, we're talking about his loneliness, we're talking about the dignity, we're talking about his pain, we're talking about his hope, we're talking about his family. So we are scientific people. We are scientific people and we should remain scientifically, but we have to deeply become human. This human touch. So this is what we people have practiced. I think almost all of us has practiced the human touch, but the next generation is forgetting this. So what should we do? We should leave it like this, or now we should take small steps to reach them, and because we can do it. Nobody else can do it. I know it very well. Because the young generation will not come forward to do all these things. Because here our role is very important and we should do little work. I don't say we have to do it aggressively. In one day we will be able to do that. But we have to somehow make the things. We all are senior doctors. And these things I am talking to you when I started my practice when I was very young. Patient and hospitals were our priorities. That is our priorities because we have to survive. We never knew how to deal with patient, duties, services. We have to improve our skill and we have to make our own institution or the institution where we are working. We have to build them. We have to create our departments. Now all the things happened. And for 12 years, I did it. And 2010, I had a problem. And then my priority changed, you know. I changed my priority. Then I was thinking my priority was not patient or hospitals. It was me from the beginning, but I somehow it didn't stuck to my mind. I was working 24/7, 365. I lost my health. So I thought, then I no, that my responsibility to myself. So my health, my family, I started looking into my own biology. My aim and objectives become very clear, and resilience came to my body. Like I again gained back everything I lost during those periods. Now 2010, 11, now 2026, 15 years. 15 years, now I think now the priority has changed. It is no more my health now. Because this is now my routine. It is in the auto mode. I don't have to do much because the things are coming every day. I'm doing the same thing since last so many years. Now I think my job is it something I wanted to give to the society back? Do I want to do something which is needed in the medical profession? Can we redefine the healthcare system? So it is a mentorship. Now the time has come to do the mentorship. We all have the responsibility to become, because we will be the best mentors. Because we have the experience, we have the knowledge, we have the time, what not. We have the money, everything we have. Only thing is that we do not think in that direction. We have never thought we can be good mentors. Because mentors and consultant are different. When we become a teacher or a consultant, we are different. Because here we teach and we treat and we come back. But mentor is a person who is always, we guide the person whom he is mentoring, holding his hand. So though we have to again start holding the hand of our next generation. How? I also don't know till date. But I think this is possible. So the priority now changed. Now we can become a bridge between the two generations. Experience leads to wisdom, leads to mentorship. We can become great mentors, and where we can change those scenario in future. I don't say it will be changing within 5 years, 1 or 2 years, but down the line, 10 years. If we work together, if we become mentors, then I think there is a hope where we can all do a great job. So the present healthcare paradox, what is the present healthcare paradox? More hospitals. We have more number of hospitals are increasing, but not necessarily a healthier society. We are not able to build a healthier society. We all know, every day when you see the OPD is swelling, fine. We see the hospitals ICU or bed are getting filled every day, and I don't think we are building this more hospitals are building more healthier society. No, we are not building. We have never tried. We are doing more investigations, but we are creating more confusion and anxiety also among the patients. Patients come, do their checkups, they come with this bunch of papers without knowing what is there inside the reports, and they are somewhere they see black and red color markings, and their anxiety is like very high. They come, sir, what is this black, and am I sick? Cancer. All these questions are coming because we are doing more and more investigations, more survival, but not always better quality of life. We are in the ICUs, we are pulling the life 10 days, 15 days, 1 month, but our quality of life we are not able to give. We all agree. I'm seeing every day we are deteriorating the quality of life, but we are making the survival thing for 15 days, 20 days, 1 month, 2 months, 6 months survival. We are giving everything for that, but not a good quality of life. We are not able to give more specialization, but sometimes less wholeness. We are fragmented. We are creating more fragmentation, but we without any wholeness. The question is, are we building a disease care industry or a healthcare industry? Now, it is you to answer. Fine. So how can we redefine the patients? That is very important. Redefining a patient means something we have to understand that. Fine. I always say we have to understand their living system. Fine. The hope they come with. Their body, their biology, we have to understand the biology. Somewhere we have understood the disease process, but we have forgotten the body. We have forgotten their mind. We have forgotten their emotions. We have forgotten their families, their food habits, their sleep, stress. So when we are treating only the disease, nothing more than this, because in this disease burden increasing day by day, we will be getting less and less time to look into this. So can we do something? Can we start treating a person? We can teach the next generation to treat persons. And it will be possible when we can build a healthier society too. When we will reduce the disease burden, then only the things will come. So it is a job of the government, no doubt about it. But this is in a public health sector. But here comes, because people come to us directly. We are not bothered about the public. We are concerned with the person. Fine. So when we treat a person, treatment becomes deeper. That is very, very essential. Fine. So here, when you redefine a patient, then I think we can take the first step towards our things. And how can we redefine this? Doctors, how can we, as a doctor, we can redefine the healthcare industry? Fine, from disease carrier to a living system, we can, if we start looking at the whole of the patient and the system as a living system, then I think we can give some of the things we can change. From prescribers to healer, educator, mentor, that I told you. A doctor can become from a prescriber to a healer, to an educator, to a mentor. This journey, somewhere we have to go through. From disease is not an enemy to us. So it's not trick, because I don't know, I've read somewhere, when we should fight against cancer, when we say we will fight against COVID, we can fighting word is a very dangerous word. You know what happens? When we utter that word, we are fighting with somebody, our body, our cells listen to a word called fight. And the perception, what the cell perceive, that I have to fight. Then automatically it goes to the fight and flight mode. Without our knowledge, the cells goes into a fight and flight mode. So the moment we talk about fighting something, then it becomes a more difficult, because our body is against now healing, because the cortisol level is very high then. So we have to treat disease not as an enemy, but we have to think there is a wrong biological signal, because when we talk about a disease as a wrong signal, which is created wrong coding in the DNA level, then we will be looking after how to create good signals, how the signal will come, because everything inside our body, it happens because of the signals. Food is a signal, sleep is a signal, exercise is a signal. So everything is a signal to our cells. So instead of considering diseases as the enemy, the patient, so almost all patients, if you go through the biography of people who have survived cancer, the people who have survived accidents. Now here, one thing is very common. I've read many books, and there only one thing was very common to them was that, you know what, they all accepted their body as it was. They have accepted their disease, and from there they started the journey of recovery. The acceptance, the moment where acceptance is there, body is not fighting anymore. Body is going towards a rest and restore mode, and it will start creating things. It will start looking for how to send good signals to my cells. Fine. So prevention from annual checkup. People think annual checkup is necessary. It's a prevention, but no, checkup is not enough. But daily self-health care, and from self-health care to self-care is the journey. That is how the prevention can happen. Fine. And from output only to quality of healing. Now the whole hospital industry, whole the corporate world, whole of the government setups, we are looking for numbers. How many OPDs we had? How many operations has been done? We are now looking at the quantity of the things. But the quality of healing is totally absent. Somewhere we are missing the bus. Somewhere we talk about quality treatment, but somewhere we are missing the quality. We are all focused on the quantity. And it is a most dangerous thing. It was not there 10 years back or 15 years back, or when our senior doctors were practicing. Number was never a game, but now the number has come and quality has gone down. So redefinition began with doctors, because doctor understands suffering, uncertainty, and the human body. Because we understand this only. In this whole healthcare industry, though we are only less than 10% of the this industry, we are the only person, and the paramedics another 2 to 3%, another 3 to or 5% of this thing. These 15% people, do you understand that what is suffering, what is, how this uncertain is the modern medicine or human bodies, and we understand the human body. That is where our picture, there is our role is now very clearly defined. So from disease care to health care. So disease care begins after disease appears, but health care begins, just a minute. So disease care begins after disease appears, but health care begins before disease dominates or disease starts. Here is our role. We can have a new role on this. Disease care focuses on diagnostic and pathology only, but we have to shift to read life patterns and the biology. Only diagnostic and pathology will not do. Somewhere we have to go one step ahead, and we have to read the pattern and the biology. Disease care controls symptoms and save lives, and healthcare restores quality of living. And in palliative care, we always say we don't want more years to the life. We want life to the years left or the days left. That is what is the quality of life. And disease care is essential, but incomplete alone. And complement, this healthcare will be complements to the modern medicine. So when we add healthcare to our disease care, and it will act as a complement, and it will complete the modern medicine of which we are a part of it. This is so JSER, that means Global Self-Healthcare Education Research, which is the platform which I have created and the form which I am representing also. So here the self-care is the sole aim. Self-care is not self-medications, because people, World Health Organization has got another section of the self-care. It calls self-medication, but I'm not touching that part. So it is educating people to understand their body before disease forces them to stop. So empowering people with the knowledge, so then they can take care of themselves, so that they will not fall into the trap of diseases. That is the whole of the aim of our organization. So self-care means informed responsibility. Then one step, if we go one step ahead, it comes out with cell care. That means we have to work on the signals or cells receiving at the level of DNA and the coding level, and how the repair and revival can happen. And it is only when we learn the cell care part, and once we do this, when we from self-care we transit to cell care, then we will come to system care, and there is the changes will start happening, because we will have healthier families, healthier people, ethical hospitals, and a greater healthy society. So when we will start taking the system care, we will be doing the societal care, which everybody talk about. So our health culture will change. So this is the dream of JSER. I don't know when I will be able to fulfill those dreams, when we will be together and hold our hands and march ahead. But a healthy doctors become a healthier signal for family, hospitals, patient, and society. So we have to lead it first, because we should be the leader. So Cellureva, which I call the trademarking of my, this is a name. Cellureva is a revival at the cellular level. It is healthcare at the cellular level, I will always say. So the human body is a living communication system. Every thought, every meal, every breath, every sleep cycle, every conflict, every recovery moment sends signals to your cells. all these, fine. If the signals are restorative, the cell moves towards repair. So our cell has got the capability of homeostasis. Everybody, we know about, we have great homeostasis mechanism. So when the signal will change, body will again come back to its normalcy. This is always there. That's how the cancer survivors survive. Few people survive cancer. Few people survive road accident. Few people survive because their signal to their cells is very authentic, and they know what to do. And you can call it willpower. You can call it, you name it, many things. But it is the signals which are restorative. This is very important. So this is our 4 models, 4R model. I always say Cellureva has got 4R models for everything. Like I have a Cellureva success formula, Cellureva health formula, Cellureva hypertension. We'll discuss from next onwards. We will be discussing on one thing: reset, revive, because everything takes 1.5 hours to 2 hours. But we'll discuss about next thing. But today, let me touch again how this Cellureva 4R model for health transformation. So in the reset phase, again we have to go through the 4 phases if we want something more. Now in this reset phase, we have to make this stress signals, confusion, fear, and biological chaos in the patients. We have to work on that. So we have to reset those things first. Then only we can go to the next step of revive. We can work on their energy level, movement, nutrition, sleep, and communication. All these things come next. Then we have to work on their belief system, because the belief system is so bad now. Like we have been taught from our childhood that if you have some problem, if you have a disease, go to the doctor. But whenever I start my program in a public forum, I ask a first question to everyone. How many of you has gone to a doctor and paid his fees and asked him, sir, tell me how to stay healthy, how to live my life? And till now, I've not seen any single hand raised. But one day, I hope somebody will raise the hand and will pay me my fee and come and ask me. Because now they are coming with all the problems. So before the problem comes, I think it will take some time. So restoration comes with the quality of life. When you improve their quality of life, improve their dignity, improve their resilience and ownership. Once they take the ownership, I think there will be a great change. So modern medicine saves lives, self-health care sustains life, cell care improves lives, and human care gives meaning to life. And this is a journey. It is not one day job. It is a very hard thing. I can tell it's a concept. I don't know how the things have come to my mind, but these are the things which is coming to gradually things. When I go deeper into it, the things are coming, and I think we can define it more better in future. And what message I want to give you all? Your lived experience must not retire with you. It's mentorship. Whatever knowledge you get, you should not go to grave with the knowledge, with the experience, and we should disseminate it, and then all of you should become mentors. We all should be mentors. When we are reaching towards 60, and I think rest of the life, we should spend some time in mentorship. Handle uncertainty. Who can handle uncertainty better than us? Who can speak to families better than us? Who can become more ethical? Because now we are the ethical people. We can remain ethical under pressure also. A young doctor may not be, but we have to teach them how. We use technology without losing touch. Like if I walk today, when I see a photograph of a person, my PGs, and when they show me a photograph and I tell the history from the photograph, they get surprised. When they tell me something, I told you this person must be having diabetes, this person must be very sick, he must be, by now he must have been intubated. And they told me, yes sir, how come you know? Because this is our experience. I can see a leg and I can tell what the patient's condition must be. I can see an ulcer and I can tell, because these are the experience of so many years. So these things should be passed on to the next generation. We can treat patient without forgetting self. Now we have time. We can prevent burnout. And we can teach people how to, because now the next generation is they have got a lot of things which never had. But still they are burnout. But they can, if somebody will guide them, they can use the technology in a better way to become greater doctors and build financial dignity and guide without controlling. So we suffered. That's why we must become wiser. We are wiser. So every day we are becoming more wiser. I think we should use this thing for us. So technology and human wisdom, how technology and human intelligence is the difference. I'll just a small slide. Artificial intelligence, the future, I always say the future will be technologically powerful, but technology alone cannot replace human wisdom. When we talk about AI, because AI is hardly 20 years, 30 years of data, they have accumulated, and then it's become AI. But we people have got a greater things, I call it is biological intelligence. We have BI. BI is 250 billions of years of intelligence, accumulated data inside our cells. So AI is very small in comparison to the BI. That's where we have to make our understanding. There's a technology, but we have a better technology within us. So we have to use both. We have to take the help of AI to improve, or to AI should be our servant. That's what I always say. Robotic has come up, but relationship has gone down. Because now the doctors are not touching. The role of robotics we have not yet defined. And how many people will be benefited by that, we also know is very less. But whole the focus is going somewhere. We are losing the focus here. Data is there, but dignity is we're losing. Protocols are there, but personhood is missing. Precision of, we are learning our technology, techniques become more precise, but our presence is getting, I think it is losing its, we're losing our presence. The future doctors is equal to treatment, plus prevention, plus self-health care, plus technology, plus human wisdom. This is the need of the time. You agree or you don't agree, but this is the truth, and we all have to understand that we have to somehow, if we can do something, we can do some magical work on this. I think we can create, we can redefine the health industry. So today's call, I can say, from disease managers to we should become health creators. For prescription providers, we have to change, perception changes. Because when we give a prescription and with that we change the perception of the patient, the medicine is going to work 10x better. That everybody, all of us know, and we have experienced it also. Hospital professionals to community educators. We have to have a transition. Fine. Organ specialist to CEO of the whole 37 trillions of cells which we human beings are made up of. Because it also needs a CEO. Though it is, they are well communicated, they are well balanced, but we are the CEO of that 37 trillions of cells, and we have to, from heart, lung, kidney, from there in the fragmentation to take, let us focus on the cell care. And once your kidney cell is healthy, your kidney will be healthy. Your heart cell is healthy, your heart will be healthy. Nobody can stop this. This is biology. This is a biology, and there are thousands of research papers all over you can look, you can search for the things, and you'll see how this, we call it system biology. Right? How the biology has gone through, we can say, what is it? Einstein era. Modern medicine is still in the Newtonian era, but biology has gone to the, that's called Einstein era, that is called E equal mc square. That is called everything is energy. Because we are made up of cells, cells are made up of atoms, atoms are made up of subatomic particles, and inside the subatomic particles, what are the things? When you go through atomic microscope, what they found out? They found that it's empty space, only subatomic particles moving in a vibration. So ultimately, we all are vibratory beings. This chair and table are also atoms, and they are also vibrating in a different frequency, and we are vibrating in a different frequency, and we all have a slight different frequency matches. So we all are energy beings. This is science, this is biology is talking about. So let us not only prevent death, let us improve the quality of life. That is the whole aim of this program. So my message today is that the next evolution of medicine is not less science, it is deeper science with deeper humanity. From disease care to health care, from prescription to perception, from survival to quality of life, from doctors as service provider to doctors as healer, mentor, educator, and reformers. Let us build a new era. Can we do it? Can we join hands together to march towards this newer redefined medication? Thank you very much.